I'm Professor Garry from Southern Cross University, Professor of Lifestyle Medicine there. I run a postgraduate course in lifestyle medicine through that university, and I'm also the Vice President these days of the Australian Society for Lifestyle Medicine, which used to be the Australian Lifestyle Medicine Association. Lifestyle medicine's a little bit more than what it sounds, because it's not just the lifestyle that leads to chronic diseases and other associated problems, health problems. It's the environment that drives the lifestyle that's important. So lifestyle medicine is a form of intervention that falls between clinical practice and public health. General practitioners need to be aware of this, though, at the moment, because 60 to 80% of the patients that they're seeing are there because they've got a lifestyle or environmentally related problem, mainly chronic disease. And this ranges from cardiovascular disease through to pulmonary diseases and even cancers. If you're going to talk about a new type of medicine, if you like, and we need these all the time because health changes according to the society that we live in. Back in the war years, for example, there were different issues associated with health. In the pre-industrial era, there were different issues associated with health. Now we know that chronic disease is the major problem. The infectious diseases have gone down, the chronic diseases have gone up. So lifestyle medicine has arisen to deal with those chronic diseases. The question then is, well, how is this different to conventional medicine? Or is it different? And if it's not different, why do we do it? The answer is that there's a different type of structure when you're talking about the determinants of lifestyle-related diseases. And there's four major aspects of that new structure. The first one is the knowledge or the science associated with lifestyle. A lot of people think that it's just two factors, nutrition and inactivity, that are the determinants of chronic disease. Sometimes they add stress, sometimes they add smoking. When you think about it, there's about 15 different determinants, and this includes things like inadequate sleep, the environment and the environment, which is the internal environment, the microbiome in the gut, for example. There's relationships, there's occupation, there's over and under exposure, there's social inequity, a whole range of different factors. And these all interact. So we no longer have a linear process where you do something and then that leads to disease. So you give a medication and that leads to good health. Because this is a systems model, all the chronic diseases interact with each other. That's the knowledge base of lifestyle-related disease. The next thing is the skills base. This is the art. How do you practice the art to teach people how to change their behaviours? And it ranges from counselling skills to motivational interviewing to rational emotive therapy to modern behaviour therapy, a whole range of different things that fit into that category. Then we have the tools, which are the devices that you can use to help people change their behaviours in particular. And this is an ongoing process, because what happens is with mHealth and with electronic health, we're getting new devices all the time. Self-monitoring is one of the most important aspects of lifestyle medicine. The final thing is the procedures. What are the actions that you carry out when you're working in lifestyle medicine that may be different to standard medicine? And the key one that we're looking at the moment is not this one-to-one counselling process, but shared medical appointments. That is where a doctor, a GP, is seeing 10 to 12 patients at a time with a skilled facilitator over an hour to an hour and a half rather than short term. Now, what this does is it enables the GP to incorporate peer support into the treatment process. Peer support then leads to self-management. We know that better self-management leads to better self-help over time, and that then, in theory at least, helps to reduce chronic disease. We are still seeing this play out at the moment in Australia in lifestyle medicine because it's such a new skill, a new art that we're looking at. Is there an infrastructure for lifestyle medicine? Well, there are associations that have started up all around the world. There's a European Society for Lifestyle Medicine. There's a US College of Lifestyle Medicine. There's an Israeli society. There are societies starting up in Africa and Brazil. So this is an indication of the need for this sort of thing because of the growth in the chronic diseases around the world as it becomes more developed. We have had the Australian Lifestyle Medicine Association for the past 7 or 8 years. It's one of the first to start. It's now changed to become the Australasian Society of Lifestyle Medicine, and it's part of the Global Lifestyle Medicine Association, which is set up with these other associations. You can find this on the website at www.lifestylemedicine.org.au, and there's a lot of information there. And there's also packages and materials that a general practitioner can use in general practice for dealing with patients with chronic disease. As well as general practitioners, there's a lot of other disciplines that are obviously involved in lifestyle medicine, and that's why it's important, is because it brings in those other disciplines. No one discipline has a monopoly on this area of lifestyle medicine. Pharmacists, for example, have a big role to play. They're seeing patients at the front line of all of this, and they can contribute not only in providing medications, but in providing information. The medications become an adjunct to lifestyle information. And as we know, it's the information about lifestyle change and the advice on how to change and to help self-manage these problems that's important. There are also a whole range of other disciplines: dietitians, exercise physiologists, psychologists, up to 14 different disciplines that would be involved in lifestyle medicine and that would interact with general practitioners and pharmacists in particular.